everybody. My name is Brandy Izquierdo, and I'm the Executive Director of Safe Project. Safe Project is a national nonprofit organization dedicated to ending the addiction epidemic. Co-founders, Admiral James Sandy Winnefeld and Mary, are also the co-chairs of SAFE, and they founded the organization in 2017 following the loss of their 19-year-old son, Jonathan, to an accidental opioid overdose. Well, the reality is over 85,000 Americans have lost their lives to overdose during August 2019 and August 2020, the highest number of Americans who have lost their lives to overdose ever recorded. We wanted to really bring together a diverse panel of individuals to talk about their experiences with stigma as it relates to mental health and addiction. Bringing more education and awareness to the issue can help to improve our perceptions, build more supportive communities.
My name is Emil. I am a person in long-term recovery. I had severe opioid use disorder, and along with any other drugs I could put in my system. I've got 2 years in recovery, 2+ years, and I am working now as a certified peer recovery specialist from here in Florida. I love my job.
I'm Brittany Riemann. I'm actually Miss Wheelchair Maryland 2021. My advocacy is awareness of substance abuse in and out of the disability community. I got my injury due to my addiction. I was under the influence of alcohol and opioids and lost control of my car, which sustained one injury, which was breaking my T12 and paralyzing me from the waist down. That was a little over 3 years ago, and I'm actually 2 years clean and sober. So that's really what drove me into wearing my sash and crown.
My name is Marcia Hawkins Ford, and I'm actually originally from Kennett, Missouri, down in the Boot. I have been working in the addictions field for the last close to 20 years. I am not a person in long-term recovery, but I'm a person with lived experiences. I hope you understand what I mean, because many who I love with all my heart have suffered and struggled with substance use disorders, and I have dedicated my life to helping others, and I'm determined to help them win. I am the executive director of the Child and Family Empowerment Center. We are the access site for the Eastern Region Recovery Support Services Program. Our organization offers level 3 outpatient treatment. We offer recovery housing for women, and we also offer recovery support services for those who want to come to groups, those who need transportation, those who want care coordination and other recovery support services.
Over 800,000 people have died from a drug overdose since 1999, and countless others from addiction-related causes. Yet so many people are afraid to speak up or seek help. What is it about addiction that keeps so many of us from talking about it?
I mean, what we're ignorant of, we ignore. And it's easy to pretend that it doesn't exist if I ignore it. And again, just the whole bad name that substance abuse and, the bad word addicts have received due to, again, society's ignorance of addiction, of the whole science of addiction. We have failed. We have failed people who are struggling with these disorders because of our unwillingness to learn how to help.
I honestly think a lot of it, just for myself, I didn't want to admit that I had a problem. There was a lot of instances that I was able to get myself out of, to where I didn't lose my house. And I've lost a lot of cars, but I was able to get more. I had the job, I had my kids. So for me, it was more or less like I didn't want to admit that I had this disease, and then the fact that I have family members that have done way worse, and then also that stigma of not wanting to be called an addict. not wanting to, be identified as that because people would look at me a certain way and, think the worst of me, which, my using wasn't because I just wanted to pick up and use. There was a lot of things that happened in my life that I realized later on was the reason why I decided to use substances to drown out those things.
For me, I would have to say the key word to this whole question would be trauma. Before my addiction started, there was trauma. And then during and, while I was using, there was trauma and the shame and the guilt I felt surrounding that was one of the reasons why I used, why I continued to use. And, one of the reasons I was prevented from getting into recovery for so long. And, while you're out there using they talk about dereliction and like the complete abandonment of the self, I existed on such a hand to mouth, like animalistic level that, looking society in the eye again after I finally got clean seemed like a really, really hard thing to do. And, looking myself in the eye as well. And I think people don't talk about it because we've been addressing it the wrong way.
When you talk about the willingness to ignore, how do you navigate through not ignoring?
It was someone who was not in my family, a gentleman who I was serving years ago. And he's like, I want to make you understand that I'm sick. I want to make you understand, to a degree that it will move you into action. And I sat and I listened to him tell me a story about him supposedly being the drug dealer, but he was his own biggest customer. Him and his girlfriend who had been, she wasn't his girlfriend, but she was a girlfriend. He told me that she left his house one night, came back, did what she had to do. She sat in the corner and she died. It wasn't until the next day that he came down. He woke up, was, more sober, and then he had a sense of care. When he told me he left his best friend there dead, I knew that there was more to this than I understood. And it lit a fire under me that has not gone out because there's so much more for me to learn. So I needed to understand what was happening to him, that he needed to get well. So and that's what we have to do. We have to start listening to the words that people are saying. He kept saying, listen to me, Miss Marsh, I left her there dead. And I went to find that drug.
Everyone always wants to hear our addiction stories, the using aspect, but nobody ever wants to talk about, what led to that.
So, it wasn't just one thing that happened. It was thousands of things. And I'm the oldest out of 6 kids. I come from addict and alcoholic parents. So really that's all I knew. My family, any event, whether it was happy, whether it was sad, everybody was either in the bathroom doing something or drinking. And that's how a lot of people dealt with their emotions. So I was already taught at a young age that, that's how people relax. That's how people deal with their emotions. And I was put into a situation where I had to take care of my brothers and sisters. And, I told myself at a very young age, I would never end up like my parents. I did the exact same things because there was a lot of things that I was taught and I was shown that I didn't know any other better. I've been sexually assaulted as well. I've been molested. And these things I blocked out. And it wasn't until I got sober that I remembered those things. When I was 15, I had my best friend. She was killed, but they labeled it as a suicide. And so that traumatic experience of my best friend dying, I didn't know what else to do, but I knew that drugs and alcohol helped me feel better for just that split second. The oldest, I had to take care of everything. So it was on my shoulders to make sure everybody was taken care of. I never took care of Brittany. I never was able to speak up. And when I did speak up, I lashed out. I was just never in atmospheres to where it's okay to be vulnerable. It's okay to talk about these things. It's okay to speak up. And, now I'm in my 30s. And when, Marsha was talking about that feeling of like, I want to go get that. I want to go get, heroin was never my choice. But I had a lot of friends and I could never understand. But see, I also thought that, they're the junkies, not me. And that's not true too, because they're fighting their own demons. When those things were in me, I didn't have that rationality to actually process these things until I got into recovery and until I put everything down. And on top of that, I was paralyzed. I have 3 children. My youngest was 8 months at the time. So, those things, not knowing like how my life was going to be, I just those were the things that made me feel good, because I had no other choice that I thought, but I do. And then getting into recovery, clearing the fog of all of those years that I have numbed and that I have just pushed and pushed and pushed. It was very hard because you're reevaluating those things. You're going back to those feelings and they're still there. So, the mental health aspect of not being able to speak out, not being able to connect with other people that have gone through these things, not knowing how to talk about these things because I felt like maybe I would get in trouble, or, I don't feel like somebody could really understand what I was going through and my pain. It was, it was confusing for a little while, but, once coming into recovery and once being able to put the drugs aside and reopening those wounds and realizing that, these things happened, we talk about them. When I have these feelings, I go and talk to somebody about them and letting, that pain lessen. And that's been, huge for me.
As far as trauma goes, I was sexually molested by a teacher's assistant when I was in elementary school. And, more than the things that he did to me physically, the damage that was the most severe was the things he said to me. And I believe that's why I carried all this shame into my adult life, because he said, don't tell anyone or you'll get in big trouble. And, as a child, when an adult tells you that, you take that seriously. And so carry this over to my adulthood as I'm a veteran. I was in the military, and I was sexually assaulted by 4 other, sailors at the time in a hazing ritual. And, in being in a place in the military where it's already frowned upon to, be like, at the time it was like a don't ask, don't tell policy about being gay. And then to have that happen to me, and I literally tried to, carry all this shame and guilt and lock it all away. And the end result of that was, complete and total dereliction of myself and through the use of substances, and I literally lost myself until 2 years ago when I found recovery, but only through some work on myself, like EMDR and the ability to take a look at that and and realize that I'm not a bad person, that just bad things happen to me.
What was the message that you actually had given to you about addiction?
As a kid, of course, the message from the schools was what? Say no to drugs.
Right.
But it was just a message. It wasn't a movement. My family, we, again, as long as I can remember, there was alcohol there. Again, for every reason, there was alcohol. But there really wasn't a message. It wasn't until I think I was in 1990 that I actually talked to a family member, which is my middle sister, about getting into recovery. It was not a conversation that we had in our family. Even, when my oldest sister lost her kids and she went through all that she went through, I don't recall us talking about, any type of recovery. It's only by the grace of God that, again, we have been connected to resources and people who have passion and who desire to learn the truth. All this is coming from, we have to be the perfect family. Don't tell anybody, this is what America, our fake standards have done. You have to be the perfect family. No one can You know, even if you're being molested in the family, or there's somebody doing drugs in the family, or someone's doing whatever, don't tell anybody. We're the perfect family. America did that. And we created all of these reasons for people to hide their hurt. You know, and all it did was cause people to isolate and go farther and farther into those dark places. America's these fake standards, false standards of a perfect life, a perfect family, there are none.
I've actually been around recovery since I was 13 years old. I had a lot of resentments towards my mother because I had to grow up. I had to be the mom. When she started recovery, it gave me my mom back. Mm-hmm. And I would go to these rooms and I actually felt at home at these rooms. I felt comfortable because there are stories that I knew, but I didn't know all of what recovery was until I did it for myself. It really, it really is another set of family, if not more. I had to go to these rooms and for myself to see like how people are doing it. And then, they are happy and they're peaceful and they're spiritual people. I knew of recovery, but I didn't know how powerful recovery was until I came in for myself. Like my perception of me being in active addiction was so negative and so dark that I really didn't see the light of what recovery could do for me until I went through it myself. And now, like, it's just glowing. Like, I want this. Like, I chased my recovery the way I chased my high.
The message I got about addiction when I was growing up was, that it was okay until you got in trouble, and then, you had to suffer the consequences, basically. But there was no real message I received about recovery growing up. My parents were both addicts. My father was an alcoholic and an addict, and they never found recovery. Luckily also today, proud to say that my mom is also in recovery now. And, for a long time, I thought we were going to race each other to the grave while we were out there using. So, regarding stigma, there's so many different answers I could bring to the table. There's some moments where I literally caused me to almost go into an explosive fit of rage in the, especially in the VA of all places. Just a quick example of, we were actually doing a Zoom call for my appointment, and I had to ask about writing a letter for me stating that my condition of my mental health was the result of the trauma that I had suffered while I was in the service. And the follow-up question to that was, are you using? That really sent me over the top, because why is that the follow-up question to, I need your help with something intimately, because I shared these details with you, and that really just sent me over the top, because I wasn't using, I was clean still. But why is that the follow-up question? And then other experiences at the VA, from picking up medication at the pharmacy, where I have sleeping pills prescribed to me for trauma that I received while I was in the service. I already have a problem with going there to receive services because of what I mentioned earlier. But when they stigmatize me in the pharmacy by yelling out that I'm receiving I can't pick up controlled substance, and that these are narcotics over my shoulder, and everyone in the line in the VA hears these things, I don't want to go back there. I really struggle with that, because I feel like I'm worthy of the services that I should get there, and that I did my time to receive those services. But it's so traumatizing to go in there and have to deal with those people that it's almost not worth it for me. My other therapist did write me the letter I was talking about, and that letter acknowledged what I had been through. And whenever I go in and I'm asked for veterans discount, or if I want to receive my veterans discount, and it happens all the time, I don't have my VA card because of my discharge, which was a result of all things I already mentioned. I have to relive that every single time. Memorial Day, I don't really leave the house. I didn't do burgers or anything, because yes, I'm a veteran, but if someone asks me about it, I have to sort of, like tiptoe around it?
I would say honestly, like early on my disability, everybody, I'm in a wheelchair and people ask how you do it, how, what happened. And, when I started at first, I wouldn't just say I got in a car accident, but then I started opening it up and it's like, well, I was drinking and driving, or I was under prescription, I was using pills, and, the looks that people give me, it was just like, oh, like a repulsive, but it wasn't too many of them, but there were. But then what really stuck out to me was when I actually was going for pain management and I tried to get off of the pills. And the doctor was looking at me and was like, well, if I was in your situation, I would be medicated all the time. And it's like, well, wait a minute, like just because I'm in a wheelchair, I mean, yes, I have pain, but I'm trying to tell you that I can't do this. I'm using these things wrong. And you as a doctor are sitting here looking at me and being like, well, if I was you, I would be, it's okay. Like, it's almost that like write-off to where because I have a disability, I should have medications because my life isn't worth living. And, that hits me a lot because I don't live my life that way. But that's where I can educate a little bit and I can put a smile on my face. But those situations, because I have to relive those situations. I have to relive my injury every day. There's things that happen and it was because of my addiction, but I shouldn't have to justify and I shouldn't have to sit there and tell you my whole story just for you to accept me. If I say no, I don't want them, then you should respect that. Or the fact that because I have this, this disability, because of it, it's not, I'm not a bad person. People just don't understand. So, opening up and being honest about how I got my disability, it's vulnerable. I had a DUI and my kids, luckily my kids got home safely, but I don't remember it. And I ended up in a jail cell and the police officers are sitting there making fun of me. Even in my injuries, the paramedics, they're sitting there and they're like, oh, this girl's trash. She's just another junkie, making all of these rude and crude comments as they're trying to save my life. I was able to tell somebody else, one of the other ambulance that actually helped me a couple weeks later. And I'm pretty sure they went and searched because they were pretty upset. But those are the kind of things that that have happened. And then they add on to the trauma. You relive those things as soon as they come up and you can't help it. There's no way of like turning it off.
When the women come up to the offices, the looks that they get, the complaints that the office get because of the women coming to receive services, all of that is, it just, it's hurtful to the women. It's hurtful to me because I'm sure, even though, again, you want to hide from your hurt, that there is someone in your family who needs the same services that these women are boldly receiving. I'm willing to meet them right where they are. I'm not telling them that, oh, I expect you to do, I'm coming where you are and meeting you where you are. But unfortunately, that's just not where we are in society, that people expect, again, for people to never have had any type of anything, or at least pretend that you have never experienced anything. Missouri Recovery Network, they did a video a couple years ago, which is phenomenal. It's called Not My Child. It's awesome because that's why so many people, even when you know it's your child, you ignore it. They talk about how all of a sudden they're not invited to the barbecues. They are, the friends leave them, all of that happens. And again, I see it on a daily basis. It hurts my feelings that they have to be subjected to that. It's no different to me than when, people say, oh, you people. And then they said, talking about Black people, and then those people, what does that even mean? Why would you even say that? And I remember one woman, she does housing for people with senior citizens, seniors who sort of like assisted living or something else. And of course she said, I don't even know how you do it because I just can't stand a liar. And I said to her, so you think that the only people who lie are people who are recovering from substance use, they're the only liars? It just sort of rubbed me the wrong way. Right. They call me Mama Marsha for a reason.
What happens when we say not my kid, and we perpetuate stigma, and it continues the cycle because we're teaching the kids that are perhaps not in addiction that they need to stay away from the kids that either either have an addiction or have parents in recovery, and we don't normalize recovery. What do you think has been most instrumental in shaping your views on people in active addiction?
When I started talking just now, I automatically almost said my name's Emil and I'm an addict because what shapes my views is my experiences in recovery in Narcotics Anonymous, or I did AA as well. I still see people in the grips of the disease every day, and it really takes me back to where I was and how far I've came and how much I don't want to be there anymore.
What's been most instrumental is people who have come through and they're in recovery. When I sit and I listen to those stories, when I listen to the fight, when I listen to their refusal to give up, it ignites a fire in me, and it helps me, again, it empowers me to help other people in recovery. People who are in recovery are my biggest advocates.
Honestly, what's been the biggest is my disability. My disability really, really put another perspective on my substance abuse, and to live in pain on a regular basis and not use any narcotics is amazing. And I thought it was unheard of. And just the stigma behind, the fact that because I'm in a wheelchair and because I have this pain that I have to be on these medications and I can't live that life. My recovery, my 12 steps, me working a program, me being of service and taking meetings into rehabilitation centers and hospitals, visiting hospitals, my advocacy, being outside of the rooms of NA and AA and showing the principles and, leading by example of what recovery looks like and what our stories. Yes, addiction has happened, but this is what's happening right now. I'm not who I was 2.5 years ago. I'm who I am right now. To see that person right now and to see what I'm doing, that's the biggest things.
How do you hope that we talk about addiction in 20 years?
I hope we talk about recovery more. I hope that recovery is more of a story than the addiction part of it. And I hope that it becomes more treated like a medical condition rather than a moral failure. That's the way most people look at it. I also hope too that medication assisted treatment becomes more acceptable in the rooms of Narcotics Anonymous and AA. I know it is becoming more acceptable, but we talked about pathways of recovery, and not everyone looks, not everyone's pathway looks the same, but what works for one person may not work for the other, but what worked for me, and I'm here as living proof of that today, so I advocate strongly for anyone that needs someone with experience in MAT in the rooms that, I could be a sponsor for those type of people, and that, it is possible to work steps also.
I want to see the disability community speak up and be, and be there, because now that I wear this, sash and crown and wheel around with a big smile on my face, people are like, what are you doing? And I get a lot of people with disabilities that say that they struggle because of our disability, because we've lived with this for so long, or, there's a traumatic experience, or they lost, all of these things. They don't have the support. I want the rooms of NA and AA to be accessible, and want the, I'm a board of a nonprofit, and I'm trying to open up a club in our area of Maryland. So, making sure that that's accessible and that we have one spot where it doesn't matter if you're blind, you're deaf, you're in a wheelchair, you're amputee. The only desire is for a new way of life. I don't want that to be 20 years from now. I want that to be as soon as possible.
In 20 years, I want the language to not be treatment, but recovery. What's being funded through the government is treatment. People want recovery. We're going to talk about the end of this thing, not the means, not treatment, but we're going to talk about recovery. That's going to be the song that everyone's going to sing, and we're going to have a beautiful harmony. We're going to have all the parts to the song, and it's going to be a beautiful harmony, because we will have saved so many people from the grips of death when we again focus on not just a little portion of it, but the whole thing of recovery. From the moment you tell me, Miss Marsha, I want to, Miss Marsha, look at me. That's what I'm after. In 20 years, those who are in the groups right now, they'll be our leaders. They'll be the ones who are the soldiers, not just the soldiers. Right. They'll be soldiers.
Pain shared is pain lessened. The more we speak up and speak out about the story before the story, the more we can shine light on not just the addiction, but the hope and the recovery and everything that it has to offer.